Hi, my name is Dr. Patrick Yachimski from Vanderbilt University Medical Center. Thank you for allowing me a few minutes to introduce the Waterjet necrosectomy device, or WAND. This work represents the collaborative effort between the Division of Gastroenterology, Hepatology, and Nutrition here at Vanderbilt University Medical Center and the Science and Technology of Robotics and Medicine, or STORM, laboratory at Vanderbilt University. My co-investigators, collaborators, and co-authors on this manuscript are Claire Londowi, Federico Camposano, Pietro Baldastri, and Keith Obstein. And I would like to acknowledge funding support provided both by the American Gastroenterological Association Foundation and the National Institutes of Health. Pancreatic fluid collections can represent one of the major sources of morbidity in patients who have suffered from severe acute pancreatitis. And endoscopic therapy has emerged as the first-line option for intervention for symptomatic pancreatic fluid collections. The initial approach typically consists of an endoscopic ultrasound-guided cyst gastrostomy. For purely liquid pancreatic fluid collections, such as pancreatic pseudocysts, this intervention alone may allow for complete resolution. However, collections of walled-off necrosis can contain significant amounts of solid debris, and complete drainage may not be achievable simply by creation of cyst gastrostomy. Next steps can include either chemical or mechanical necrosectomy by an endoscopic approach. Mechanical necrosectomy is currently performed using endoscopic accessories such as polypectomy snares, biopsy forceps, rat tooth forceps, biliary extraction baskets, retrieval nets, etc., off-label. And there are significant disadvantages to this approach, including the fact that none of these devices was specifically designed for this purpose. None has been rigorously investigated for this purpose with regards to either efficacy or safety. The devices are inefficient at best. Numerous devices may be used per case, resulting in excess cost, and multiple endoscopic treatment sessions may be required over a prolonged course of illness to achieve the desired outcome. So the WAND is intended to be a single-use disposable device specifically designed and dedicated for pancreatic necrosectomy. It is composed from a combination of off-the-shelf and custom 3D printed biocompatible parts, the latter made from a resin. The WAND can be used with a standard upper gastrointestinal endoscope and fits through a 2.8 millimeter working channel. And the principle is that the WAND will deliver high pressure irrigation capable of fragmenting non-viable necrotic tissue, yet sparing healthy tissue. Sterile water is used as the irrigant, and the WAND can deliver up to 0.5 liters per minute of fluid at a pressure of up to 90 psi. And to put this in some context, this is a higher pressure than is used for laparoscopic irrigators, but a lower pressure than is used for surgical hydrodissection instruments. We have completed 3 phases of preclinical testing. Phase 1 demonstrated the ability of the WAND to fragment gelatin as a surrogate for pancreatic necrosis, and I've included a snippet of a video here, which in addition shows a feature of the WAND which has been designed to include independent tip articulation of the device to allow enhanced maneuverability within a confined necrotic cavity. Phase 2 demonstrated the ability of the WAND to fragment pancreatic necrosis freshly harvested from a pancreatic necrosectomy case. Phase 3 was intended to determine some measure of the safety of the device. Yorkshire landrace swine were utilized, and in a fresh necropsy specimen, the WAND was used to deliver irrigation to several tissues including pancreas, small intestine, stomach, liver, and aorta at both higher pressure and more extended duration than would be anticipated for in-human clinical use. and no gross findings of tissue trauma were observed. We are in the process of obtaining regulatory approval for first-in-human studies. We are optimistic that this device has the potential to be a game changer in the endoscopic management of pancreatic necrosis. I would encourage you to visit our manuscript and videos, and thank you for your attention.